Complex coronary intervention is essentially a term recently used to describe the ability of interventional cardiologists to use the new technology to open up blocked arteries for patients and achieve long-term results in ways which are not been possible before, simply because of the lack of technology and the lack of technical ability and training of the operators to achieve that. So that's a combination of highly skilled, trained operators and using very new technology to open up arteries in means that has not been possible before. This type of procedure is absolutely necessary because in previous years, there are type of disease and blocked arteries which were impossible to open percutaneously or by microsurgery. And these patients were often referred for open heart surgery. Now patients are getting older and more frail, and many of these patients who have complex coronary disease are not suitable to have open heart surgery, but the new technology has enabled us now to be able to achieve good long-term successful results in complex coronary disease in patients who were previously seemed not suitable for open heart surgery, and the technology were not available before to open up these arteries percutaneously or by keyhole surgery. So it is absolutely necessary because it provides an excellent result and a very good quality of life for patients, which was not able, in ways which we were not able to do before. Complex coronary intervention performed in the same way as any simple coronary intervention. It's all through a keyhole puncture in the wrist often. Sometimes we use 2 punctures or 1, depending on the type of the procedure that we're going to do. And then the techniques used are often involve using technology of calcium modification or wires to open up chronically occluded arteries and so on, new microcatheters, new techniques. However, for the patient, the procedure is not any different from doing any kind of coronary intervention, except that it sometimes often takes slightly longer. But the procedure itself is, from a patient perspective, is done in the same way as any kind of coronary intervention. Most patients can recover from complex coronary intervention in the same day. Most of the patients can go home 4 to 6 hours, 6 hours after the procedure. So if we finish early, the patient can go home on the same day. In certain cases, if we finish late or if we used the procedure was long, the patient can stay overnight and go home next day straight away and resume normal life almost immediately after that. The world of coronary intervention has evolved incredibly fast in recent years. This is mainly because of the availability of new wires, microcatheters, calcium modification techniques that were not available in previous years, but also the operators and the training and the technical skill has improved dramatically in recent years in ways which were not available before, or the technologies allowed operators to improve their training and techniques in ways which has evolved very quickly in recent years. So it's a combination of new technology and higher, better skilled operators.